The dense smoke from the wildfires burning in Alberta and neighboring provinces is having a big impact on air quality. The smoke is now sitting heavy over the city of Calgary, and people are really feeling it.
It's a real hazard.
I left my windows open last night, and of course my apartment is now full of smoke, so it's not nice.
The air quality index for Calgary is listed as high risk this morning. Many people say the smoke is irritating their nose and throat, and for some it's affecting their breathing. So we want to talk more about this. Dr. Sumir Gupta is here now with what you need to know about prolonged exposure to wildfire smoke. He's a respirologist and associate professor at the University of Toronto's Department of Medicine, joining us from Toronto. Good to see you this morning.
Good to see you, Jennifer.
So it has now been about 2 weeks of significant wildfires in Alberta, and that comes with varying degrees of smoke in the air, hazy skies, which have spread right across the country, in fact. Staying inside isn't really an option anymore, given the time frame here. And I believe we have a map where we can just show people how widespread the smoke is across. There it is. So really quite extraordinary to see how far the smoke has spread. This is from Fire Smoke Canada, an organization that tracks such things. Chris Murphy was telling us a little earlier this morning, Dr. Gupta, that in fact this area has had one of the highest, one of the worst air qualities in the world from organizations that track that. So my question to you, what can people do if they must go outside to live their lives?
Yeah, it's really tough. As you say, the smoke and these tiny particles that come out of these fires, they don't respect borders and boundaries. And so you see this wide swath that's affected, including into the cities where most people live. And you're right, it's safer indoors because the air is filtered, but eventually people have to get on with their lives and go out. And you can see that, you can almost see the smoke there in these images. The number one thing is to wear a mask, and luckily people have gotten some familiarity with that and gotten used to that through the pandemic. It really should be an N95 mask because we're talking about these tiny, tiny particles that get filtered out by those N95 masks. And so if you're going to go out, wear that mask. If you're going to be out there, remember that these particles get into your body by breathing them in. And so if you're doing exercise, you're breathing more. So the advice there is to not actually do exercise outdoors. It's one of the rare times that it's actually better for your health to avoid exercise. So if you're going to be out there, don't do any vigorous exercise and wear that N95 mask and be as far as you can from the source. In the city, as you can see, it's really blanketing the entire city. So those are really the things to do.
And we're now seeing, due to the number of people evacuated, some of the evacuation centers are so over capacity, people are having to stay in tents outside. So that's an even greater risk, wouldn't it be? What can people do to protect themselves there?
Yeah, the tent situation is tricky because you've got crowding, and so we can't forget that we still have COVID around. We still have spread of COVID disease, and so that's always a concern in these situations. And then depending on the tent, you're not going to have probably the degree of filtration, air filtration, and control of that outside air that you're going to get in a conventional building where you have that central air filtration and tight seals around windows and doors. So more of that smoke is going to get in. All they can really do in those situations probably is HEPA filtration, put in a bunch of HEPA filters to try to keep that air clean. Not much more you can do in that situation. If the air is affected in the tent, you can also wear a mask in that tent. But those kinds of tents are going to have a lot of those small particles and smoke inside as well, unfortunately.
And who would be at the highest risk of experiencing health effects caused by wildfire smoke? I'm thinking, for example, if someone with asthma would be the obvious, but I know it's quite a list.
It is. Anybody with underlying lung disease, whether it's asthma or COPD or the many other lung diseases that people are affected by, because you're breathing in these particles and this smoke and these noxious gases through the lungs, they are going to irritate the lungs. And if your lungs are starting off with a lower capacity, a lower functionality, then you're at risk. Similarly, people with heart disease, we can't forget that we do see a spike in admissions and emergency room visits for heart attacks and angina when we have forest fires and wildfires like this, because some of these particles get into the bloodstream and affect the heart. So people with underlying heart disease are at risk. And then, as always, it's the very younger and the elderly that are at risk because their systems just aren't as well developed to protect against this.
And what about pregnant women?
Pregnant women are also at higher risk with exposure, and so is the fetus. So there are some fetal outcomes that have been identified as well that are lower with prolonged exposure and repeated exposure during pregnancy. And so again, it's one of the categories that's there for almost anything because of all the changes that happen during pregnancy, and people become more susceptible to various different health effects, including smoke inhalation effects.
So I'm wondering what kind of symptoms people should be watching for, indications that they might experience that would tell them it's actually time to seek help. Beyond even, I can imagine it must be irritating to the eyes and feeling at the back of your throat. But at what point is it time to go see a doctor?
Yeah, for sure. So there's local stuff like, as you say, eyes, nose, mouth irritation with smoke and even particulate matter exposure. You can get atopic dermatitis, so skin stuff. You'll see on the list there things that are affecting the lungs, so shortness of breath, wheezing, cough, things like this that you might see particularly in people with asthma or COPD, or people who have those conditions and don't necessarily know it, but they're sort of brought out by exposure to that very irritating smoke and those tiny particles. Also chest pain, so people with heart disease may get chest pain, they may get palpitations. Again, some people have heart disease and don't know it, and it's putting themselves in that very high stress situation where you're really putting the heart through that stress, where this comes out and becomes evident. And then the other thing I'll mention is that if you have prolonged exposure, particularly around a smoldering fire, even if it's outdoors, if there isn't a lot of wind, there is a risk of carbon monoxide poisoning. And some of the signs of that are more subtle. So it's things like dizziness, nausea, headaches, and that is one of the ways that people actually die from smoke inhalation, usually in enclosed environments. But if you are in an area where there's a smoldering fire and you're there for a prolonged period without a lot of circulation through wind, that is one of the risks, even with wildfires.
That is such important advice. And on that last point, you make me think of the volunteer firefighters who may not have access to the kind of equipment that a professional firefighter would have in terms of that kind of exposure repeatedly. So my last question to you is about damage. I mean, you're talking about perhaps, temporary impacts to the body, but what kind of damage can be caused to one's lungs during an event like this? Are they irreversible? And I'm thinking even of people who live in fire zones and experience this almost every year.
Yeah, so it's a good question. So there's two things. One is smoke inhalation. When you're really close to the source, perhaps you're a firefighter, that smoke inhalation can cause lung damage. And some of that lung damage, if it's severe enough, can be permanent. It can leave you with permanent scars in the lungs. And then there's the idea that you're further out. Maybe you're even in the city, but you're close enough that you have repeated exposure to high levels of particulate matter. And even in this case, we're seeing a little bit of smoke in the cities. And if that happens in a repeated way, there are studies that suggest the higher risk of chronic lung diseases, a higher risk of heart disease through that repeated exposure. There are even some studies that suggest a higher risk of certain respiratory types of cancer. So there are these long-term risks associated.
Dr. Gupta, always great to get your insights. Thank you for this.
My pleasure.